Gaza has been pounded by airstrikes for 31 days. Health officials in the enclave say the toll has crossed 10,000. In Israel, more than 1,400 people have died, and more than 200 people still remain in Hamas captivity. Now, there are growing calls for a ceasefire. Israeli Prime Minister Benjamin Netanyahu and U.S. President Joe Biden have discussed so-called tactical pauses to allow civilians the opportunity to safely depart from areas of ongoing fighting. Now, for more on this, let's speak with Hiba Tibi. She is Country Director of CARE International for the West Bank and Gaza, and she's joining us live now from Ramallah in the West Bank. Ms. Hiba, thank you so much for joining us. Now, 1 month has passed. How has the situation worsened in Gaza? And if you could, give us a sense of what it was like even before this latest conflict.
Thank you so much for this question. This is one of the hardest answers I can give on the current situation. But let me start even before war, as you mentioned. Before war, there was a long blockade on Gaza. And what happened is that the basic living services were extremely affected. And even the UN has declared that Gaza is not a place that is suitable for living in terms of access to water, access to electricity, the type of land for planting, the agricultural practices, etc. This was the situation before war. After war, the situation became extremely negative, extremely affected. We can consider it as your report mentioned, a human crisis, a humanity crisis, where everything now is in a massive need, starting from access to water, and of course there is no electricity, and the fuel was replacing it to generate electricity. Now there is no fuel. This means that the people are unable to transport food. First of all, if there is any food, they are unable to access medical facilities where they are extremely lacking medical supplies. They are unable to access water for hygiene purposes, and most importantly, drinking water. So we have heard over the last weeks that people are consuming contaminated water. Now, all of the people on the south even, they are using contaminated people. They don't use treated water because of lack of electricity and fuel. And examples are coming live from our colleagues who are in Gaza, from my team, and also our partners who were, as you know, displaced from the north towards the south, where they themselves became internally displaced people. They don't have food, mainly bread. They don't have bread. And of course, the other commodities, they are in shortage since the beginning of the war, but now they don't have it. And this is why we see that many actors call it thirst war or hunger war. All of that is under constant shelling and bombing, where the full population in Gaza is not only affected by the access to basic needs, but also psychologically deeply traumatized with what is happening in terms of the size and the length of shelling and bombing.
Yeah.
This is the situation in the south.
It does sound dire and very tragic, Ms. Hiba. We also understand that CARE, like most other international voices, have demanded a ceasefire. The U.S. government and its allies, meanwhile, want humanitarian corridors or tactical pauses instead. How can these so-called corridors or pauses benefit the people of Gaza and emergency personnel and aid agencies on the ground?
So there is a bit of difference, a big difference between the pauses and the ceasefire. What we want and what we requested since the beginning is a ceasefire. And in this ceasefire, it's not only the stop of the violent actions, but also it will allow the humanitarian services to come and pass through Gaza, and for the humanitarian organizations and teams like CARE and others to safely operate and access those in need. Now, the size of destruction in Gaza requires long-term intervention where people are trying to pull themselves together. From Gaza, it's a survival mode. Others can join, can help, like us and other organizations. But with the tactical or humanitarian poses or humanitarian corridors, with all these various names, it will be a short term and for selected areas. Now, even with that, of course, this is better than nothing. But even if we have the ceasefire, the full ceasefire, the intervention will require lots of time. So with the poses, it will not be possible for the teams to operate as efficient as possible compared to the longer term, to the ceasefire, where we are more in a capacity to receive, distribute, and save lives.
In one of your reports, Ms. Hiba, you said that things are set to get more critical as winter is approaching. What would be the biggest concern or challenge for care and aid workers on the ground?
So let's start with our teams in Gaza. They are displaced. They are staying now either in the UN designated shelters that are overcrowded, or they are hosted by their family members in apartments that also overcrowded. One of my colleagues is sharing an apartment with 120 people. That has been said. All of them with the displacement, with the evacuation, many of the people came a little bit late. So they are not even inside the shelters. They are staying in the outdoor, outside the shelters. They don't have enough, for instance, clothes. They don't, they did not pack and they were able to leave. So the situation is that there are shelters, people are outdoor, overcrowded, so it's not suitable for continuous work. Already there are diseases related to lack of water or consumption of contaminated water, and the winter is on the door with other type of diseases. Now my colleagues, most of them, when I talked to them yesterday in the night, and after the connection, they explained that they have flu. So now it's already started, these diseases, and you can imagine how the situation will happen. As you can see in the images on the screen that you are bringing up, there are no equipment to clear up the places where we can even set refugee camps. But all of this is going to, if we have a ceasefire, this can be fixed in a very quick manner. All organizations are going to collaborate, cooperate, and we can sort of at least ensure that no one is in the outdoor or at least in these extremely overcrowded shelters.
Ms. Hiba, I'm afraid we have run out of time, but thank you so much for speaking with us. Ms. Hiba Tibi, the Country Director for the West Bank and Gaza from CARE International.